Hi guys, I'm just back with a quick video, and I was just going to show you how to do some soft tissue work around some muscles around your neck. I've been in touch with a few people who've contacted me and they've got some stiff muscles in their neck, and it's hard to get to see anyone at the minute because of the lockdown, so you can have to do your own work. So that's why I'm going to show you how to do a bit of soft tissue stuff on yourself. Okay, so there's a couple of key muscles that we could really work on. Inside here we have these muscles called sternocleidomastoid, big long name, and what they do is they insert here in the collarbone, and it has two muscle attachments and it attaches deep in here. So they can cause like a lot of headaches and sort of temporal pain, forehead pain, and even pain into the eyes. So it's a really good idea to be able to know how to work on these. So what you can do is actually, you can say use a bit of oil first of all, and what you can do is you just put it on your finger pads, and then what you're going to do is you're going to work down. So you're going to pull down across these tissues down towards that bone like that. Okay, you want to be digging in because you've got a lot of blood vessels and deeper nerves in here, so it's just kind of like drawing down across the tissue like this all the way down here. Okay, so drawing down, 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 down like this. Now what you can do then, as well as you're doing this, bring your fingers down, you can bring your head back into the side like this as well. So I'm bringing my fingers down, and then what I'm going to do is bring my head back into extension, and I'm going to bring it off to the side like that. And you're going to get a nice kind of stretch. It's kind of like a burning stretch. It's not very nice, but it's really good for loosening up these muscles. Now the other thing that you can do is sometimes if I cough, you can see the muscles here, and you can actually just kind of pinch it a little bit. So there you're kind of lifting. It feels quite tendinous here, and this is the muscle junction here. And what you do is bring your head forward so you kind of get some slack in the muscle, and then what you can do is you can just kind of grip it here then like this, and I would just hold this and do some breathing, and you can actually often feel it twitching, and it kind of deactivates it. And then what you can do is you can just move up. So you're just kind of pinching it and lifting it and pulling it off ever so slightly. Same thing then on here, pinching it like that, bringing your head down and just working up the muscle. Okay, so that's for those muscles here. You also have a bunch of muscles in here called the scalene muscles, and they're a little bit deeper, so they're just kind of behind this muscle, and you can just kind of bring your fingers in, you might feel it, and you just can do the same kind of thing, bringing your fingers down and bringing it off to the side like that. So bringing your fingers down and off the side. And what happens when the scalenes get very, very tight, they can pinch around a big bundle of nerves called the brachial plexus, which is in your neck, and that can actually cause sensation in your shoulder, kind of numbing sensation. It's very kind of diffuse, it's hard to pinpoint, and it's kind of like a heaviness, and you can even get it down into your wrist, into the median, ulnar, radial nerves, into your fingers. But usually the problem is coming up from here, so you'll probably feel that your whole neck feels stiff as well. So that's really good as well. Okay, so working into those areas. Then also what you can do is you come around the back of your skull, and there's two rigid bones at the bottom of your skull. Okay, and what you can do is you just get your fingers in underneath these two rigid bones, because a lot of muscles attach in here, namely the big trapezius, which is a big diamond shaped muscle, the suboccipital muscles as well. So what I would do is get your fingers in and just sort of push in underneath those two rigid bones, and deep breathing while you're doing that. And then also what you can do is you can bring your head back a bit, and you can kind of do this while giving your fingers in here like this. I would do that as well. And then also what I would do is I would drop your head down and push in with your fingers a little bit as well. And but just even sitting on with your head back, sinking into your thumbs, can really deactivate these muscles as well. Okay, so give that a go. If you've any questions, drop me an email, info@bodymechanics.ie, or 08794366093. Keep safe, look after yourselves, and I'll chat to you again soon. Bye bye.